What's going on, everybody, and welcome to the Easy Thyroid YouTube channel. I know it's been a while since I uploaded a video to this channel, but I have been so busy with school. This was my final semester and I was trying to balance it with work and school. You know, it was very challenging for me. And what I did, I already pre-recorded a video, but I just didn't have the time to upload it. So I hope that you enjoyed this video that I prepared for you. And yeah, I'm going to stop talking now so you can get watching the video. In today's video, we are going to be looking at how to read your lab results for your thyroid test. Now, this might seem very simple, but there are some people out there who have no idea how to read theirs. Now, I will share with you my lab results, which was taken on February 3rd. But first, I think we should talk about the different tests there are. Now, a simple test would give helpful information on a person's thyroid health, but usually more than one is needed to give, the complete picture. So by comparing the results of a thyroid test, a healthcare provider can tell if you have hypothyroidism, which is low thyroid function, hyperthyroidism, which is too much function, or an autoimmune disease such as Graves' disease. Okay, now, so the purpose of the test is to measure, again, the function of the thyroid. And this is accomplished by analyzing the substances generated by the thyroid gland and other organs that regulate the thyroid function. Now, the thyroid stimulating hormone, or the TSH as you would like to call it, for example, is produced by the pituitary gland in the brain. And what it does, it regulates the thyroid gland production of the hormones T3 and T4. Now, when these numbers are added together, right, they reveal a lot about how well or how badly your thyroid gland is doing. Now, thyroid function tests often look for hormones, protein, and immune system agents known as antibodies, among other things in the blood. But today we are only going to look at a few of them. And the very first one we're going to look at is, I think you can guess this, which is the TSH. Now, the thyroid stimulating hormone is a hormone generated by the pituitary gland that maintains the balance of thyroid hormones in the circulation, and that includes the T4 and the T3. Now, this is often the first test your doctor will perform to see if you have thyroid hormone imbalance. Thyroid hormone deficiency, which is hypothyroidism, is usually accompanied, and I want you to get this, by an increase of TSH level, whereas thyroid hormone excess, hyperthyroidism, is usually accompanied by low TSH level. Now, if the TSH is abnormal, then thyroid hormones such as T4 and T3 may be measured directly to further investigate the cause. The next test we're going to look at is the T4, and this is a thyroxine test for hypothyroidism and hyperthyroidism, as well as, thyroid problem therapy monitoring. Now, hypothyroidism is characterized by low T4, and hyperthyroidism is characterized by an excessive T4. The next one we're going to look at is FT4, aka free T4, aka free thyroxine. And this test is done to help diagnose thyroid disease, to monitor the effectiveness of thyroid treatment, and sometimes a free T4 is used to help diagnose congenital hypothyroidism in newborns. Now, the next test we're going to look at is T3. And these tests are used to detect hyperthyroidism and to determine the severity of the condition. So T3 levels can be low in hypothyroidism, but this test is more typically used to diagnose and treat hyperthyroidism when T3 levels are excessive. Our last test we're going to look at is thyroid antibodies. Now, these tests help to identify different types of autoimmune thyroid conditions, and that is pretty much it for the test. So, okay, now that I explained to you the different tests, I will now share with you my results, and you should be seeing them on the screen. So, as I said that I was tested on February 3rd, and here are my results. Now, normally when you see test results, the ranges are given, and that is to give the doctor an idea as to where your levels are at, and obviously to get the correct diagnosis. So as you will notice that there are only two tests, which are the TSH and the T4. Now you will also notice on the right that there are ranges for the levels of the test. And according to my doctor, they, meaning the clinic, they only pay attention to the TSH because it controls the production of the hormone. But in your clinic, they might do things differently. So as you can see that the range for the TSH is 0.3225 UIU per milliliter, which is micro international units per milliliter, and the T4 is 10.7 to 20.8 pmol per liter, which is picomoles per liter or picomoles per liter. So as you can see that my result is a bit high, but my doctor said it's nothing to worry about. So as you can see here for the TSH, my levels are 0.49, which is pretty good. So I could conclude that the doctor concluded that my levels are very good. And I feel good, I exercise, I drink plenty of water. So right now I'm living a normal life. And I took a test previous to this one, and sorry I don't have the results to share with you, but my TSH was higher than it is now. And the reason being was because I was skipping my meds. And I thought I was doing so for a good reason. Now you see, at the time I was breaking out really badly, and I came to the conclusion that it was my meds. And so I started taking them like every other day to see if they will make a difference. Then I started to experience mild symptoms, and that is what made me go to the doctor to get a blood test done. So the results came back, and the doctor was like, are you sure you're taking your thyroid meds? And I was like, yes. And then, I told her, okay, well, I was taking them every other day. And she was like, yep, I can tell by your results. So then she explained to me the importance of taking my meds every day. And since then, I made sure that I take them every day. Oh, and before I forget, one of the questions that I asked the doctor was, is there any chance my thyroid function will function again? And she said that is very high unlikely, because the previous test for the TSH would have been like a 0.01, which would indicate that the thyroid is functioning again. But right now you see it's 0.49, so there is no way that it is functioning. So I do think, for me personally, I need to include more iodine in my diet, and that is something that I definitely want to do. Take another blood test results and share my results. Now I'm not advising that you do the same. This is just me. Okay, so all right guys, that is pretty much it for this video. If you want to know when I get that update, then please like, comment, and subscribe so you don't miss that video. Until next time, bye.